Viagra and Cialis are two erectile dysfunction drugs proven to work. Now researchers have reformulated those medications to treat another disease, pulmonary hypertension. The interesting twist here is that most patients with pulmonary hypertension are women.
We're gonna look for shark's teeth.
A day to dig for treasures with 6-year-old Ethan. It's something Lyn Repsher thought could never happen when she heard the diagnosis 11 years ago.
You're looking at your future thinking that you're gonna have a family, and suddenly you're diagnosed with something that is gonna change your perspective on all of that.
Lyn has pulmonary hypertension, a potentially deadly disease. For years, she dealt with treatment that involved 24-hour-a-day IV delivery of medication through a pump that she had to carry around with her. But now, thanks to drugs that were originally marketed for erectile dysfunction, she's through with all that.
One of the drugs that was reformulated for pulmonary hypertension was Viagra.
Dr. Charles Berger says another one is Cialis. You see, pulmonary hypertension is high blood pressure in your lungs. It happens when the tiny arteries that carry blood to your lungs becomes narrow. Your heart has to pump harder to push the blood through, causing pressure to rise. The increased workload can lead to heart failure. It's like a kink in a water hose. The ED drugs lower pressure in the lungs by opening up the narrowed arteries, restoring blood flow, and reducing the workload of your heart.
So if you can lower those pressures, it's analogous to taking the kink out of the water hose and allowing the flow through the water hose rather than just trying to turn up the pressure at the spigot.
And because doses of ED medications most patients like Lyn take are much lower than those used for erectile dysfunction, there are few, shall we say, unwanted side effects.
No.
In addition to the ED drugs, Lyn also takes another medication which is administered under her skin through a tiny tube. These therapies have freed her from the hassles of high-maintenance treatment and the symptoms of disease. Some of the symptoms Lyn had before included shortness of breath and fatigue. For Medical Edge, I'm Vivien Williams.